pre-concussion, just to summarize, we're going magnesium, theanine. Now, is theanine a supplement as well, or is that green? Just drink green tea?
Both, I would say, but you can get it as a supplement. Obviously, all these recommendations, I'm going to say it right from the start, is making sure that you're working with your healthcare practitioner. Nothing that I'm saying here is a prescription, but these are considerations from an educational perspective that I think are worthy looking at. And there's many other things actually, Cam, and we may talk about a number of them in the future. For example, there's evidence on curcumin. There's evidence on, I mentioned green tea. There's plant molecules like resveratrol, N-acetylcysteine. Like we'll touch on some of these.
And these are all pre-injury? And it's the same thing, same idea.
Exactly.
Having optimal levels potentially decreases the severity of the injury itself.
Yeah.
So, for example, one of the questions we had come in early was, as a pro MMA fighter, so this person is a professional mixed martial arts fighter, obviously subjecting themselves to potential for concussion, day in and day out. Right. Is there, what would you recommend as almost a cocktail for somebody like that? It would probably depend on a lot of, what their levels are and things like that. But let's say somebody that just wanted to, optimize as best they could at least.
Well, all the things that we just talked about, without, everybody's different. So what I will say is that, it's hard for me to give a protocol if it's not my patient, because I need to kind of have that. But something like, I would say omega-3s is a really important piece. I know we'll talk about keto shortly, but I think omega-3s are probably the best known supplement that is related to neurological health. Sure. Your pregnant women take it, people that are aging take it, and so there's quite a bit of research on omega-3s, both pre and post injury. Again, I mentioned it takes a while to get these omega-3 fatty acids to be incorporated into the cellular membrane. And once they're incorporated in that cell membrane, when that trauma occurs, now what they're doing is producing more of an anti-inflammatory cascade along with that inflammatory cascade.
So mitigate it.
They will mitigate it, and I think they'll also speed the resolution of it, because we'll talk about inflammation, but inflammation is this two sides of a coin. We often think of inflammation as something we just want to cut and get rid of. But remember, the body is not dumb. It does things always for a reason. That inflammation is part of the cleanup process after that injury. The issue with chronic unresolving symptoms in post-concussion syndrome is that never flips into that resolution phase. And that could be because they are deficient in a whole host of these key resolution factors, and omega-3s are a key resolution factor.
Question up there. Is magnesium threonate threonate? Is it the same as
threonate,
magnesium glycinate?
It's not. It is obviously half of it's the same, like magnesium is the same, but it's attached to the amino acid called threonate. And this particular amino acid I do use quite a bit because it's probably the most brain-specific type of magnesium. Threonate. It has some preliminary research, I believe, out of UCLA and MIT, I believe, or Stanford, MIT, looking at that it has the ability to get past the blood-brain barrier a little bit better, so the absorption is better, so that threonate amino acid brings it up through the blood-brain barrier better. So I find clinically with this particular type of amino acid, patients feel calmer. And glycine does that too, but even this is, I would say, even more. So
even better.
Yeah, I think it's a really good form, and it is a bit more expensive though.
Oh.
So that's the kind of trade-off. Magnesium glycinate is.
Get what you pay for, as I always say.
Usually, yeah.
Get what you pay for.